My capstone project is the development of a survivor-centered, trauma-informed, advocacy-focused response coordination with surveillance synchronization, because that is a mouthful. I call it S.T.A.R.S. It's a framework for a coordinated community response to intimate partner violence. Before we really get started, in the goal of transparency, it's really important to know that much of the available research and resources are gender-based and focus on male to female violence. Using cis-normative language can be harmful, limiting, and inaccurate, as not all victim survivors identify as women. While much of this project discusses violence perpetrated by men against women due to its higher prevalence and the available existing research, violence can also occur against men and persons from other marginalized communities. The term victim can also be harmful and disempowering. Therefore, whenever possible, I use inclusive terms, victim survivor. Moreover, domestic violence and intimate partner violence are often used interchangeably, though they're very different. Unfortunately, this creates barriers in legislation, responder training, and knowledge and public perception. The CDC defines domestic violence as violence within a household that can be between any two people, such as a parent and child, siblings, roommates, or extended family members. Intimate partner violence can only occur between romantic partners or ex-partners who may or may not live within the same household. Intimate partner violence entails a pervasive power and control dichotomy involving various cultural and social components. I've been asked a lot what my inspiration is to do this work. When I was 8 years old, two things happened that should have fundamentally changed my life. Unfortunately, only one did. The 1994 Violence Against Women Act was written into federal legislation. Women were finally going to be safe from violence. In that same year, during third grade recess, a boy in my class pulled me off a swing, pushed me to the ground, and pulled my hair. While women all over the US cried tears of relief, my mom wiped tears of pain, explaining that boys pick on girls they like. This lie set a fundamental direction for my life, that love hurts, and I myself became a victim of intimate partner violence for almost a decade. Though my own history has certainly been instrumental in my career as a midwife and an advocate, the catalyst to my interest in systems level change was more than 25 years later, when I heard someone else lie to my daughter with those exact same words when she cried about a boy teasing her at school. But my inspiration moves beyond my own sphere. Intimate partner violence is a global epidemic with well-researched short and long-term irreversible consequences to mental, physical, sexual, and reproductive health. It's estimated that homicide is the leading cause of death in pregnancy, though actual numbers are unknown, mainly due to insufficient tracking protocols. It is surmised that 50 to 75% of individuals abused before pregnancy are abused while pregnant. In fact, intimate partner violence during pregnancy is more common than the two most routinely screened for conditions, gestational diabetes and preeclampsia. It's estimated that 77% of pregnant homicide victims are killed in their first trimester, and they are not often included in maternal mortality reviews. According to the National Coalition Against Domestic Violence, more than 43% of Black women have experienced physical violence from an intimate partner and are at the highest risk of dying by intimate partner homicide. American Indian and Alaska Native women experience assault and domestic violence at a staggering rate of 84% in a lifetime. Within the LGBTQIA community, intimate partner violence occurs at a rate equal to or higher than that of heterosexual communities. LGBTQIA individuals experience unique forms of intimate partner violence, as well as distinctive barriers to seeking help. You see, lies like boys tease girls they like turn into biased cultural phrases such as, if she didn't like it, she would leave, which turn into systems failures that produce those statistics. Throughout this project, I was tasked with creating three specific aims. The first was to conduct a literature review to understand the historical development of IPV prevention and response efforts and the context in which IPV help-seeking barriers and facilitators unfold. The second was to engage with community stakeholders, seeking collaborative relationships and expert guidance regarding the current response and management of IPV, and investigate the receptiveness of a survivor-centered coordinated community response. And the third was to develop framework for a coordinated community response to IPV. I also accompanied this with a cross-systems training guide and a responder deployment protocol. So how do I accomplish all of these things in a year? I'm going to tell you. The purpose of the literature review, again, was to analyze the systems level response practices for intimate partner violence, identify responder-inflicted harms, barriers, and facilitators to help seeking. I used PubMed, Google Scholar, and CINAHL to search the terms you see on your screen in varying combinations. Further inclusion criteria included publication after 2011, published in English, a geographical focus on the United States. Articles were selected based on title and abstract, relevance to the establishing the history and the context of the system's responses to IPV in the US. I also used forward and backward reference chaining of chosen articles to find additional relevant or clarifying themes. The literature review moves through all of the major systems level entry points for victim survivors, such as the criminal justice system, victims of social services, child welfare services, and healthcare, revealing that while much good has been done in systems efforts to combat intimate partner violence since the 1970s Battered Women's Movement and the passage of the 1994 Violence Against Women Act, unfortunately, mandatory and other policies enacted have also created accidental adversaries among system responders, as well as additional barriers that reduce help-seeking behaviors and increase revictimization, criminalization of victim survivors, and intimate partner homicide. These are especially apparent among historically oppressed and marginalized communities, such as Black, Indigenous, people of color, lesbian, gay, bisexual, transgender, queer, questioning, intersex, asexual persons, disabled persons, and pregnant persons. Intimate partner homicide still remains one of the leading causes of femicide and maternal mortality in the United States, with the highest disparities being for women of color. The literature revealed intersecting themes lacking across all stakeholder systems that could decrease revictimization, criminalization, morbidity, and mortality of exposed individuals, and increase help-seeking, safety, and long-term well-being. Those are survivor-centered responses, trauma-informed practices, advocacy-focused approaches, response coordination, and a synchronization of surveillance and tracking. Engaging with system stakeholder responders was completed continuously throughout this project by engaging with stakeholders here in Bay County, Florida. The experts were employed within current IPV response systems within the criminal justice, child welfare, social victim services, and in healthcare. The goal was to build relationships and partnerships to engage in discussion about current approaches to response and management, identify help-seeking barriers and facilitators for exposed individuals, as well as identify systems level barriers and facilitators to coordination efforts. I also really wanted to see the feasibility of a coordinated community response to improve outcomes. I believe this to be the most personally impactful part of my project. Getting to know these individuals within the responding systems really addressed my own personal bias of the systems. I was able to meet individuals who may have different goals or missions, but are equally fueled by passion and a drive to do good in this world. It's really easy to villainize whole systems, and for many years, I've done this work through my own lens, with little thought to the actual people behind the protocols. Engaging with these responders reminded me that community-facing personnel are all called to this work to do good, and my encounters truly showed me that a coordinated response could create lasting change. This is a visual representation of the S.T.A.R.S intersectional framework that was designed by turning the intersecting themes identified into actionable strategies for current systems level responses. Survivor-centered responses focus on addressing needs by incorporating victim survivors as stakeholder voices whose input is incorporated for protocol and program design. Further, survivor-centered approaches work to expand individual victim survivor autonomy and decision-making to empower individuals to decide how best to address their own individual needs. Trauma-informed policies and practices strengthen organizational commitments to anti-oppressive and culturally sensitive, humble, and appropriate responder training and education about the complexities of intimate partner violence. This approach is especially important for those in vulnerable and marginalized communities. An advocacy-focused approach enables responders to offer appropriate, accessible, and equitable community-based referrals to services that address the individual's needs. Response coordination within the community stakeholder organizations has the potential to improve institutional empathy by implementing strategies to improve communication and teamwork that will redress harms caused to victims and survivors. A synchronization of surveillance and tracking systems would allow for a more accurate data to assess the prevalence and impact of intimate partner violence. It's especially necessary in cases of intimate partner homicide to ensure that victim-perpetrator relationship characteristics and pregnancy status are included in local, state, and national level databases. This chart further demonstrates how using S.T.A.R.S framework offers responders across all systems an opportunity to move away from dangerous responder bias and knowledge inadequacy to find a balance between responder roles and the needs and autonomy of victim survivors. Service organizations can implement best practices that work towards safety, inclusion, equity, and long-term well-being for victim survivors. By instituting safe and competent screening services, rather than engaging in hazardous misuses of mandatory reporting protocols, responders have the opportunity to decrease revictimization and even mortality and morbidity. Responding organizations can build institutional empathy and coordination with each other and avoid leaving victim survivors to find their own resources. Resolving these conflicting dynamics are especially important for historically vulnerable and marginalized communities. The barriers listed are the mandatory policies and practices stemming from the 1994 Violence Against Women Act that continue to remain largely unchanged. This chart further shows actionable facilitators and strategies target partners can use to decrease revictimization, morbidity, and mortality of individuals exposed to intimate partner violence. While I was doing my literature review, one of the main commonalities across all systems I found was a lack of responder knowledge or training. That's what inspired the S.T.A.R.S Cross Systems Training Guide. This is an actionable, comprehensive training guide designed for responders from different sectors to be brought together and expand their knowledge and skills while learning both together and from each other. This training guide has been made available in the form of a 91-page document with 8 evidence-informed modules. The anticipated audience for this training is community stakeholders and responders, such as police officers, social workers, healthcare professionals, victim advocates. It presents the opportunity for providers to share their own experiences and increase institutional empathy. Learning objectives include things like identifying system-level response and prevention efforts and their evolution, acquire a basic knowledge of terminology and its context, characterize various types and methods of abuse, also identifying cultural differences and patterns, identify possible traumatic brain injury from strangulation or head trauma, identify how racism and bias are contributing to the frightening mortality rates and lack of action for missing and murdered Indigenous women, differentiate between the goals and the realities of mandatory reporting, examine the contexts in which mandatory reporting impacts historically marginalized communities. And this is the third piece of my capstone project. This is a visual representation using the drivers of change and the essential elements identified in the S.T.A.R.S framework. This response protocol has been created incorporating all stakeholder systems, responders, and community-facing support organizations, and serves as an actionable step-by-step plan on how each stakeholder will respond, coordinate, and connect to other systems when encountering an individual exposed to intimate partner violence. The protocol attempted to foster survivor-centered objectives with informed decision-making, autonomy, and empowerment to enable victim survivors to make decisions about who and what services are involved in their care. The way this works is when a disclosure or a positive screen occurs with any system responder, they would start this process. They would call the S.T.A.R.S victim advocate to the scene, who would then explain the task force and the roles of each organization or service involved. The advocate would then complete a lethality assessment and an escalation timeline. If the provider does not consent to further S.T.A.R.S involvement, the advocate will offer contact information and a list of resources, and then document the encounter. Responding systems obviously must continue with their own organizational protocols. For example, if an officer calls the S.T.A.R.S advocate to the scene, but the person does not want intervention, the officer must maintain his department's protocols and practices. If consent is gained, then the advocate will sit with the victim survivor, and together they will create an individualized plan with whichever S.T.A.R.S community services are incorporated or desired. Once the care plan has been completed, the advocate will then initiate warm referrals to each S.T.A.R.S coordinating organization and work as the facilitator between the victim survivor and the S.T.A.R.S service or community-facing resource. This works with things like mental health, housing, financial support, vocational support, anything really the client needs. Throughout the care, there will be case review and staffings. Everybody that is included in the team will gather together, and they will be able to create case reviews where all members can communicate progress or concerns or add other input to the case. And survivors may attend, obviously, if that's something they want to do. This project had continual focus on inclusivity, cultural sensitivity, and humility. Each section of this project was reviewed by my advisory committee members, as well as by responding professionals, victims, survivors, and individuals that hail from historically marginalized communities. While the language and literature is often exclusive, this project aimed to be inclusive and uplifting by replacing potentially harmful words and phrases with neutral language. This project also can be implemented in any community setting. Every community has these major systems and additional resources. So the training guides, all of it can be applied and flexible. There are a lot of limitations, I feel like, to this project. First and foremost, many of the mandatory policies and practices that are currently in place have not changed since the 1994 Violence Against Women Act. It'll be really challenging for systems level stakeholders to entertain such an innovative approach. When the literature talks about community response models or coordinated community response models, typically what they're saying is two organizations working together. So you may notice now that law enforcement brings in advocates, or one organization may bring in an advocate. But to my knowledge, there is not a framework that incorporates all of the major entry points. There were also, with the time constraints of this being a one-year program, the curriculum is not exhaustive by any means and will continue to grow after I've graduated. And my literature review was not an exhaustive search. Future research should include effectiveness of cross-systems coordinated responses with all responding stakeholders, combining quantitative community data with qualitative data of victim survivors to identify all successes and failures. Systems data should also be pooled within the community to consider the intersections of the entirety of the community's response. My next steps for this program, if I'm dreaming big, are to pilot it. I'd love to pilot this framework in a community setting to gauge its effectiveness in decreasing barriers to help seeking, revictimization, morbidity, and mortality. Ideally, the S.T.A.R.S framework would be implemented by a victim service organization with cross-system responder buy-in from law enforcement, child welfare, and social services, as well as healthcare. However, before implementing, I would pool the community data regarding IPV, and I would analyze it to get baseline ideas of how the community is already responding, and then reevaluate again after S.T.A.R.S has been in place for a certain amount of time. These are some of my most influential references. I cannot even tell you how many references I have used throughout my literature review, my curriculum, kind of all of it. But these were some of the ones that were the most eye-opening to me. I especially liked the very first one, why opposing hyperincarceration should be central to the work of anti-domestic violence movements. It's really enlightening for anybody that wants to read something awesome. I'm gonna try really hard not to cry. This project would not have been made possible without the support of my committee members, to Kristen Efland, my chair, who lost uncountable hours of sleep editing draft after draft of every single component of my project. Your red pen is certainly mightier than any sword. I will never be able to verbalize the gratitude I have for you and the many, many crisis management sessions in which you calmed all of my doubts. To Dr. Courtney Everson, who has inspired me to be exceptional. You have challenged me always to view the world beyond my own lens and never to allow my doubts be bigger than the good that I can do in this world. To my cohort mates, since day one, I have been in total awe of all of you. You are some of the most brilliant minds I have ever encountered, and I'm so honored to be here with all of you today. Thank you for deadline reminders and check-ins and all of the love and support you have shown me this year. You all know it's been a rough year. This project began long before I thought I could ever contribute to the world around me. The path that has brought me to this moment has been both tumultuous and glorious. Along the journey, I have been blessed to be supported by incredible people. To Rachel Cook, who began as my teacher and became my dearest friend, you are an irrevocable force in my life, and I would not be here without your support. To my sister Stephanie, when we were young, you used to wake me up in the middle of the night to listen to the baby babble of my dreams. 35 years later, you still listen to every single one of them and celebrate with me when they become reality. To Tim, thank you for never, ever forgetting my fire when I seem to. You're always there to remind me. Most importantly, to my family, to my husband, Kenneth, your love and your support has been unwavering. There has never been a single second that your faith in me or my mission has faltered. I will forever be in awe when I think of how the stars aligned and erupted into such an incredible life with you. To my children, I hope that someday you will look back on these years of divided attention with books without pictures, endless paper writing, and deadlines. And I hope that you will know that every hour I miss with you has brought me a little bit closer to making your future a safer place. To Aria, You have the most intensely passionate sense of justice. You inspire me daily to keep fighting for justice for survivors. To Ayla, your profound empathy is a constant reminder that drive is not enough to do good in this world. One must first and foremost meet people where they are. To Jackson, your kind and tender heart is my safe place. You taught me my most important lesson, how to hold space and love unconditionally. To Sebastian, your contagious laugh has filled this world even in the most stressful times with sounds of joy. You have taught me that laughter is healing. To all of my children, thank you for choosing me to be your mom and giving me something to fight for. It is because of you that I have transformed into a warrior. Thank you.
Yes,
Thank
congratulations. Amazing work. I told her she didn't have to do 3 master's projects, but we're grateful that you did. If there are any questions right away, please feel free to unmute yourself. If any of others of you have questions forming, you can put them in the chat or raise your hand, and we'll make sure to make time for questions here today. Christina, do you want to go?
I shall go. I shall open the round of questions. So Cassandra, thank you so much for all of your wonderful work on this, and for making this one of the combinations of your lifelong passion for advocating for intimate partner violence survivors. So my question is, because you were saying that there's limitations associated with current legislation around mandatory reporting and other issues surrounding intimate partner violence. What if you had a magic wand, okay, and if you could wave it, what would be some piece of legislation that you would change that you think would support more cooperation between different stakeholders that offers support to intimate partner violence survivors?
That is so tough to answer because there's so many things that need to be changed across the board. The criminalization of perpetrators is nothing. More than often, if a perpetrator is charged at all, it's usually a misdemeanor. So I think that's one thing that's really important to understand. The second, when children are included, it changes the dynamics significantly. And when children are involved with intimate partner violence relationships, even if they've never been harmed, are more likely to be criminalized themselves as victims. So if I had a magic wand, I think the first thing that I would change is, I don't want to say harsher sentences, but it just doesn't feel like the legal system takes it seriously as a crime. If I were to, for example, walk outside and get hit by a stranger, they would be facing felonies. But if it was my partner, they're unlikely to face any issues. So that's what I would do.
Thank you.
I don't even know if that answered your question. I went on a tangent. I apologize.
No, it did. It really did. Thank you.
That is what happens when you get deeply embedded in work, Sandra.
Yeah.
You can't help but not go off on, someone asks you a simple question, I don't know why, and and you have to limit yourself to in answering their questions. So because you really have immersed yourself in this to to that status of expertise. So creator, yeah. And because so yes, you will go off on tangents anytime someone asks you about this work. And so just kudos and big congratulations. This is really important.
Thank you. Thank you.
And much like all of our students, you deserve much rest and some downtime. So I do hope you will take it. This is incredible work. Christina has something too, but I wondered if you want to say some more. I know you said some next steps, but if you have more thoughts about what might be next for you, if you want to share anything or.
Yeah. And also, Kristen, Erica has a question in the chat. Okay. So when you could now.
Yeah.
I'm going to answer that one first so I don't forget it. What's next for I honestly don't know what's next for me. I love midwifery so much. It has brought me so much joy, but it has also taught me a really important lesson that maybe I'm meant to midwife systems. And so I don't know what that looks like yet, but I think that's something that I have to really consider and think about.
That sounds great. I know it's going to be great. Erica, did you want to unmute and ask, or would you like me to read it? If I don't hear from you, I'll just go ahead and.
Yeah, I'm going to unmute. It's a little bit noisy where I am, but super great work, Cassandra. I'm just looking forward to seeing you pilot this program and just wondering what might be low-hanging fruit for you, if you will, to get this piloted. I know that if you had all the resources, it would be something that you'd want to take the next step on as soon as possible. Just where do you think would be a good place for this to start, a good community to work with, or organization, and that sort of thing?
Yeah, that's a fantastic question. So ideally, when I mentioned that it should be with an established victim services organization. So a lot of, not all, but a lot of communities have, for example, domestic violence shelters or already established things, or working with a domestic violence coalition. The reason for that is because there is conflict if working with, for example, child welfare organizations who have a priority of the children. So ideally, I would hope to pilot this with kind of any organization that stays committed to the survivor autonomy piece, but most importantly, somebody like a victim services organization that understands the complexities already and won't make me negotiate on, shortchanging victim survivors. Does that answer that question?
Yes, thank you. Yeah, so good luck. Good luck with it.
Thank you.